am Dr. Anurag Bajpai, pediatric endocrinologist at Regency Center for Diabetes Endocrinology and Research and director at MedEClasses. I am thrilled to launch the next generation pediatric endocrinology application as part of the MedEClasses endocrinology mobile application, which is a one-of-kind mobile application that allows implementation of complicated pediatric endocrine algorithms regarding evaluation and management of disorders on the click of the button. Launched in 2019, MedEClasses endocrinology application is the most widely downloaded pediatric endocrinology application across the globe, available both at Android and iOS platforms. Pediatric endocrinology is considered to be one branch of pediatrics which has got a lot of issues in terms of evaluation and management. The conditions incorporated in the part of pediatric endocrinology are vast and diverse, and they can have varied clinical presentations requiring significant evaluation and management. Lack of exposure to pediatric endocrinology during training period and lack of specialists in various resource-poor countries makes implementation of complicated pediatric endocrinology protocols in routine clinical practice difficult. There are a number of books which are available in the subject which can help guide evaluation. There are various guidelines which are available, and there are various societies who have published their protocols in terms of evaluation and management. Unfortunately, these guidelines are not being implemented routinely in terms of day-to-day clinical practice across a vast area of the globe. Delayed evaluation and management of pediatric endocrine disorders can have a significant impact in terms of overall outcome of these disorders, emphasizing the need for a timely evaluation and management. Over the last 9 years or so, we at MedEClasses have been working towards enhancing pediatric endocrine care by developing modules which are evidence-made, developing algorithms which provide guidance in terms of evaluation and management. After conducting a number of online and on-site workshops, developing modules which has got a lot of animated videos and text and books, we realized that at the end of the day, the clinician needs a tool which provides immediate guidance and evaluation. The conventional approach with regards to the evaluation and management of a complicated case has traditionally been to go back to the books, have a look at them and come back. Unfortunately, many books are so voluminous in terms of overall pathophysiology, especially for pediatric endocrinology perspective, that it becomes very, very difficult to really manage a case. Imagine a scenario wherein you are faced with a child who has persistent hypoglycemia, the sugars are persistently low. If you go back and read a standard textbook and start reading about pathophysiology, etiology, evaluation, by the time you come to management, a lot of time has gone. While understanding the textbook knowledge and the basic pathophysiology is essential, we also need to have tools which can guide us and help us with regards to immediate evaluation and management. The availability of smart mobile phones provides us with an opportunity to provide ways of point-of-care guidance in terms of evaluation and management of a wide variety of pediatric endocrine conditions. This led us to the development of the MedEClasses endocrinology application around 6 years ago, which provides instantaneous guidance with regards to evaluation and management of complex endocrine disorders. The MedEClasses endocrinology application has got a number of components that provide specific and stepwise guidance towards management of complicated pediatric endocrine disorders. On one hand, we have got approach pathways, which basically are in the form of question-answer format, in that the clinician will have to answer specific questions related to a particular disorder or presentation, and based upon the responses to those questions, subsequent questions will come up till a final diagnosis and suggested evaluation and management has been done. The calculator field of the MedEClasses endocrinology application has got a number of tools which provides instantaneous guidance with regards to the assessment of a child. The MedEClasses bone age tool has been developed with an aim of reducing the burden on clinicians with regards to bone age assessment. The validation of various arms of the MedEClasses endocrinology application has culminated in a number of publications and presentations across a number of national and international conferences. The third generation MedEClasses endocrinology application provides further insights and makes instantaneous guidance with regards to input of a very limited number of parameters. The most important aspect of this is the incorporation and development of multiple interpreters, which really interpret a wide variety of conditions using minimal inputs. So we have developed interpreters for electrolytes, calcium disorders, glucose disorders, thyroid scenarios, puberty, growth, and diabetes, in which limited inputs would immediately guide about the likely diagnosis, the required evaluation, and the suggested treatment. These interpreters are essentially algorithms in action. The tools are made in a way that we are dealing with a particular patient. So if you have a patient with hypoglycemia, all you need to do is to enter the age of the child and the glucose level. Based upon that, the interpreter will first decide whether this child actually is having hypoglycemia or not. If not, what will be the investigations? So instead of the algorithm which is there, it will really run through the algorithms. You have to go there and download the application and sign up if you are not registered with our portal earlier. The access to the mobile application is complimentary for the first 7 days, followed by a subscription fee. The tool is available on both Android and iOS store. Please explore our tool and we will love to have your feedback.